Good afternoon. I am Terry Lum, a professor in the University of Hong Kong. Thank you for giving me this opportunity to share the Hong Kong perspective in COVID-19. So let me first share my PowerPoint. So let me first talk about the current condition of COVID-19 in Hong Kong. So as of yesterday, we have 11,410 cases, confirmed. Amongst them, 204 people were killed by the virus. And if you look at the percentage of confirmed case by age group, so you can see majority of people who are infected with the virus are adults who are between 20 to 59. Older person has a slightly elevated risk of infection as compared with the general public. And then if you look into the situation in Hong Kong, the number of confirmed cases is relatively low compared with other countries. The number of deaths is also relatively low compared with other countries. And we did not have a complete lockdown of the city in the last year. And then we also have a very strong surveillance program to track all confirmed cases and their close contacts. And the relatively positive outcome is a result of community spontaneous response as well as the government policy responses. This is a kind of a graph showing the 4 outbreaks of COVID-19 in Hong Kong. So the first outbreak was introduced by an import case from mainland China. It was really relatively small. And then the second outbreak started from March of last year was due to overseas students coming back from their country of study to Hong Kong. It was mainly due to deteriorating situation in those countries. And the third wave and the fourth wave are due to imported cases as well as for large cluster of local outbreak. So, but when we talk about COVID-19 in Hong Kong, we need to start the story from the SARS epidemic in 2003. So during the SARS epidemic, we have a little bit more than 7,000 people infected with the SARS virus worldwide. But amongst them, close to 2,000 were from Hong Kong. So Hong Kong kind of bore the additional burden or heavy burden of the SARS epidemic. And then if you look at the people who were infected with the SARS virus in Hong Kong, we found out care home residents or nursing home residents are particularly vulnerable as their risk of contacting the SARS virus was 5 times that of the general population. And most infection of nursing home residents were acquired during hospital visits. Therefore, cutting the transmission between hospitals and nursing homes should be an important defense to protect nursing home residents. A higher proportion of elderly SARS patients required intensive care and mechanical ventilation and had longer hospital stays. Therefore, thereby increasing the burden on healthcare system. And since both SARS and COVID-19 are caused by the novel coronavirus, the lesson we learned from the SARS epidemic have been put into practice from the beginning of the COVID-19 epidemic. So right at the very beginning of the COVID-19 epidemics, the community has very big spontaneous response to COVID-19. It was before the government has major policy initiative to try to control the COVID-19. So in late January, 74.5% of Hong Kong residents were already, wearing face masks. So that was when Hong Kong only started, when the virus only started showing up in Hong Kong. And by mid-February, 97.5% of Hong Kong residents, already wore, face masks. And then they also practice enhanced hand hygiene by frequent use of hand sanitizer and hand washing. So a survey conducted in mid-February also found that 92.5% of residents in Hong Kong reported frequent hand washing or sanitizing their hand. And then 90.2% of adults at that time also reported that they avoided going to crowded places. So those are spontaneous response by the community without the instruction or the policy by the government. And then the government also started to develop policy response to the COVID-19. The first one is at a very early phase. The government already limited the visitation to nursing home as well as other care facility. And the government also developed a very comprehensive tracking and tracing system. In Hong Kong, we isolate all infected patients in hospital for treatment. And we also isolate their close contact, usually family members or co-workers, in special quarantine center for observation for up to 14 days. And then we impose the travel restriction and travel ban. And we closed school since February of last year. And school only started reopening from the last semester. Most companies allow flexible working hours arrangement to reduce the number of people using public transportation, as well as number of people in office. And the government also prohibit gathering of more than 4 people in public. Later into the semester, into the epidemic, particularly in the last few months, the government also started larger scale community screening. So we do not impose compulsory large scale to everyone, but we have some targeted population, like those who are working in nursing home, the restaurant worker. They are required to undergo compulsory virus screening every other week. And started about 2 months ago, the government also had imposed some small scale lockdown. Usually the lockdown is about 12 hours, started at 7 p.m. in the evening and end at 7 a.m. In the morning. And then the government will seal off or block off several buildings or a section of a district and require everyone in that district, to go through a compulsory screening. And those screening usually done somewhere by the midnight. And then by the morning or before 7 p.m., usually the result of the screening will be released. And a message will send to the cell phone of the people participated in the required for the to go through the screening. If the results are negative, they will be allowed to go to work or to leave the quarantine sites. And if they were found positive with the virus, they will be sent to hospital. And then the government also require quarantine of all incoming visitors for 21 days in special designated quarantine hotel. Um, I need to talk a little bit more about the nursing home situation in Hong Kong. Since most countries, including Canada, nursing home residents are the majority of people killed by the virus. So at the very beginning, Hong Kong already imposed very stringent limitation on visitation and hygiene patterns immediately, at the beginning of the epidemic. And most providers, in fact, they impose visitation rule or hygiene patterns above and beyond the requirement of the government. And all face-to-face visits by outsider, including family member or volunteers, were terminated in February. And then the nursing home some nursing home operators promote the use of information technology as a means to connect residents with their family member. And then all staff at the morning before they get into the nursing home for work, they need to have their body temperature checked. And if they have any fever or other signs of respiratory infection, they will not be allowed to work. and they are required to go through the virus test, and they will be allowed to come back to work after they get the negative results. And they are all required to wear face masks all day while working. And most residents or all residents are required to wear face masks in public areas inside the care home. And they are asked to eat and to stay in rooms in their room most of the time. And as I said before, strict hand hygiene patterns is observed in nursing home. Um, Sorry, the wrong direction. Okay. Um, the government, as I said before, the government developed a comprehensive tracking and tracing system. So that system was launched on February 3rd, 2000. So it is more than a year old now. And it is a public-private partnership. It is a website jointly developed by the government as well as a group of volunteers from the Smart City Consortium of Hong Kong. So let me show you about the website or the dashboard. So this is a screen capture from the dashboard. So here is show the map of Hong Kong, the urban area. So all the pink dots are buildings with confirmed COVID-19 infection, uh, recently. And then we have the blue dot and the green dot. Those are, a building with confirmed case at, earlier phase. And then, so we can use this map to identify COVID-19 building with COVID-19 patients or confirmed cases in your neighborhood. Let me show you this graph. The square here in the middle is the University of Hong Kong, so my university. So right next to the university, there is a pink drop here. So it is a confirmed case number 11253. And that patient is a male, 26 years old, Hong Kong resident. So I know exactly, which building in my neighborhood has a confirmed case. So I will be a little bit more careful if I need to go to those, building, or I can, as much as possible, I will avoid going to those neighborhood. In fact, I was told the nursing home staff, actually, they will check each day to see whether, their building have a confirmed case or not. So if they live in a building with confirmed case, they will be sent to to do the compulsory virus test, and they will only be allowed to come back to work when the virus test is negative. And we also give very good information to trace the source of incoming or the imported cases. For example, as of yesterday, all the import cases, 501 of them were from United Kingdom, and then 298 cases were imported from India. And we also provide very detailed information on each single cases. For example, the number one case in Hong Kong was reported to the government on January 23rd, 2020. And then the onset day was 2 days ago. That means January 21st, 2020. And that patient is a male, 39 years old. And he was discharged from hospital already. He was a year old. And that person is a non-Hong Kong resident. So it is an imported case. We also get very detailed information on large cluster of more than 10 people. So for example, I want to show you here, this is the first nursing home outbreak in Hong Kong. So it was in June of 2020. So from January to June, we were able to protect all nursing homes without any single cases of nursing home residents get infected. But the first outbreak was in mid-June. So the first nursing home is a private nursing home. So within, throughout that, during the outbreak, 45 residents from that nursing home was infected with the virus. And then this is the latest large cluster outbreak in Hong Kong. So it was from a fitness center, a gym, right next to the university. So as of yesterday, it is still ongoing, but the number of new cases each day has dropped significantly. So from something like 30, 40 cases each day to a low single digit each day. So as of yesterday, altogether 150 people from that cluster was confirmed that, infection. So we have not done any very large scale compulsory testing, but we did targeted compulsory testing of all potential contact of confirmed case. Usually, as I said before, family members, co-worker, and then we also do compulsory screening for people belong to high risk group, such as a test or a public bus driver, staff of restaurants, staff of nursing homes, staff of gym or fitness center, and then people who are living in buildings with confirmed cases also need to go through compulsory screening. And the screening are done in a community center and free of charge. And about 2 months ago, we started, small-scale community lockdown. Usually, the government will seal off several buildings. The criteria has been if the building has more than one confirmed case with unknown source, or the government also do sewage tests. So if the sewage test show that the building has, is a source of the virus, but there may or may not be confirmed case, the government will seal off the building and ask everyone in that building or in that section of the community to go through compulsory virus test. So you may ask, if they decided not to participate, what will be the consequence? They will be, if they get caught, without, following the instruction, they will be fined for 5,000 Hong Kong dollar, and then also still need to go to do the compulsory virus test. So these are the picture taken, from the site where the government sealed off and did the community lockdown. So as I said, the community lockdown affects several buildings or a small section of the community. So this is picture taken from the sewage water testing for the COVID-19. So let me conclude our experience. So we were able to put the COVID-19 under reasonable control without a total lockdown of the city. And we were able to protect the healthcare system. So the healthcare system has not been overwhelmed. And then all school, we stopped the face-to-face teaching in the second semester of last year. In the first semester of this year, we use hybrid mode. So some students are allowed to come back to school, but they are not required to do so. And then all restaurants, they are allowed to open. During the peak of the COVID-19 outbreak, they are asked to close at 6 p.m. No evening dining. But as of today, evening dining is okay. But only limitation is each table can have a maximum of up to 4 people. And the government also require everyone that get into restaurant to register themselves, either through an app or fill in the form, their name, their entry time, as well as their phone number. So in case there is any, confirmed case related to the restaurant, then the system will send an alarm to the people and ask them to go to the test center for virus tests. And then most business they have been able to continue as usual throughout the last year. Only thing that they are required to do or advised to do is to allow staff to have a work from home option. So these are the experience of COVID-19 in Hong Kong. Thank you for your attention.